Good afternoon, everyone. My name is John Millar. I'm the director of the Cranford Public Library, and this afternoon's program is sponsored by the library. If you're interested in knowing what else we're sponsoring, there's a newsletter in the back which will tell you everything that's coming up in March and April. And now we have Justin Lubenow here from Senior Advisors. This is Justin's second visit here. We had him back in July of last year, I think. The presentation is very informative, and I know that you'll get a lot out of it. So here's Justin.
Thank you, John. Is this? It's on. And thanks, everyone, for coming out today. I thought just before I jump into the slides, I'll give you just a brief introduction into Senior Advisors as well as myself personally. Senior Advisors was started by my father about 10 years ago. He's been in the insurance business for about 30 years. I started out in group benefits doing for small companies, generally 2 to 100 employees, the major medical insurance, life, disability, that sort of thing for the group benefits. About 10 years ago, he noticed there's a pretty large demand for Medicare that he wasn't really solving for within his groups. And Senior Advisors was formed about 10 years ago, focused and specialized on Medicare. And since then, it's grown. We have about 20,000 Medicare clients across the country, mostly in the Northeast here, New Jersey, Pennsylvania, New York, but we are licensed in 23 states across the country. My background, I actually spent 15 years in corporate America, not in the insurance business. I was an account director for different software companies. And about a year ago, I got the call. My father's getting up there, and he's looking for his kind of exit plan or exit strategy. So I joined full-time about a year ago. I opened an office right down the street, actually, in Cranford. I live in Westfield, so it was nice and easy for me to be local here. His office is down in South Jersey in Morristown. So that's a little bit of background on Senior Advisors and myself. But today's presentation is, as John mentioned, it's purely educational, informative on Medicare and how Medicare works. How do Medicare supplements work? How do Medicare Advantage plans work? We're going to get into the prescription drug plans as well. That's Part D of Medicare, and the dreaded donut hole. If anybody's heard of the donut hole or the coverage gap, we'll get into that and how that works. And we're also going to cover the 5 biggest mistakes that we see people make on Medicare, and hopefully you can avoid these mistakes that we'll go through here in the presentation today. So before I jump in, can I just get a show of hands? How many people are currently on Medicare already? Okay, that's a good mix. So how many, just so I can see the hands, how many are not yet on Medicare? Okay. So it's a pretty good mix. And we're going to get into, so we'll touch on topics that I think will appeal to both if you're already on Medicare as well as if you haven't enrolled yet. And make it interactive. If you have questions, please ask throughout, and we'll get into it. So there's 4 parts to Medicare. And anybody, so the Part A is the first part. Anybody know what Part A of Medicare covers? Hospital, right. So Part A of Medicare is your hospital benefit. It also covers your skilled nursing facility care if you get transferred to the skilled nursing facility as part of a hospitalization. Okay? Anybody know what Part B of Medicare covers? Exactly. So Part B is everything essentially that's outside of the hospital. It's your doctor's visits, your testing, your x-rays, outpatient surgery, chemotherapy, kidney dialysis, preventative services. All of that would fall under Part B of Medicare. Okay? Does anyone know what Part C of Medicare is? No. I'm hearing lots of prescriptions, and no, it's not a supplement. So I actually think this term is a misnomer. I don't believe it's really a part of Medicare, but it's actually another way for you to take your Medicare benefits. It's also called a Medicare Advantage plan. Okay, so Part C of Medicare, and we're going to get into this in more detail, is synonymous with Medicare Advantage. So it's a different way for you to take your Medicare benefits. Okay, it's a fully privatized insurance plan. So an insurance company essentially takes over and manages your hospital benefit, your doctor's benefits, and in most cases your prescription benefits as well. Okay, but we'll get into more detail on what that means. It's not supplemental. We're gonna talk about what a Medicare supplement is, which is different than a Medicare Advantage plan. Okay, Part D of Medicare. There we go. Part D of Medicare is the prescription drug plan, okay? And we're going to get into a few examples on how Part D of Medicare works, what the different parts within Part D of Medicare are, and looking at an example with someone's list of drugs as far as how that works with the best drug card for that individual. So the bottom of this table has a premium amount. Who do you pay the premium to for, let's say, Part A and Part B? Uncle Sam, so the government essentially. So this is what you'd have to pay for Part A and B. You pay this premium to the government essentially for your benefits under Part A and B. Okay, the majority of people pay what for Part A of Medicare? Right. Zero, right. So majority of people do not pay a premium for Part A of Medicare. Does anyone know the rule as far as who actually has to pay for Part A of Medicare? No. Okay. So essentially, as long as you've worked 40 quarters in your lifetime, which is basically 10 years, doesn't have to be consecutive, and you've contributed to the Social Security system and Medicare tax, or your spouse has worked for those 40 quarters and contributed, then you do not have to pay for your Part A premium. Okay, so again, the majority of people are in that situation. For the people that do have to pay for Part A, it's actually quite expensive. It's over $400 a month just for the Part A premium to the government. Okay? Part B premium. How much does someone have to pay for Part B of Medicare? There you go. Yes, good answer. So Part B of Medicare is actually, it is income dependent. So the majority of people this year are paying $121.80 or $104.90. And I'll explain the difference on the next slide as far as who's paying which of those premiums. Part C of Medicare, I'm not going to get into specific pricing for Medicare Advantage plans today, but just know that it varies. It depends on the insurance company and the specific Medicare Advantage plan that's out there. But for purposes of today, again, I'm not going to get into specific Medicare Advantage plans. And Part D of Medicare, the drug plans, this is also going to vary based upon the drug card that you select. And for some people, it'll just be the premium for the drug card. But if you're in a higher income bracket, there's also an additional premium you have to pay to the government for your Part D of Medicare. Okay? All right, so this table here shows those Part B premiums. So again, I mentioned the majority of people fall into this first bracket, which is if you're single, it's under $85,000 modified adjusted gross income. If you're filing jointly, it's under $170,000 modified adjusted gross income. Okay? If you're in one of the higher income brackets, you pay anywhere from $170 a month up to $389 per month for your Part B premiums. Okay. Does anyone know for that first bracket who's fortunate enough to pay the $104.90 versus the $121.80? Yes. So essentially, there's a rule that's called the hold harmless provision, okay, which essentially states if you're in that first income bracket and you're taking Social Security payments and you're on Medicare, and your cost of living adjustment, what was the cost of living adjustment on Social Security this year? 0. Right. So if your cost of living adjustment is 0, then your Part B premiums cannot be increased. So the people that were on Social Security last year and Medicare last year and in that first income bracket, are continuing to pay $104.90 this year. They did not get an increase on their Part B premiums because they're hold harmless or held harmless, which is the provision. Okay? If you don't meet those three criteria, so you could have been on Medicare last year and not taking Social Security, or you maybe you just signed up for Medicare this year, then you're going to, either one of those conditions, you're going to pay the higher, the $121.80 per month. Okay? Yes, question. It's modified adjusted gross income. So it's basically, and I'm not an accountant, but this would be it's something you look on your tax return, and it's looking at the income from the last full year of income reports that the government has. So for 2016, what income are they looking at? 2014. Okay, because at the time at which they're setting the 2016 premiums, this is in the fourth quarter of 2015, so they don't have the full year tax records for 2015 yet. So they're looking at your income, modified adjusted gross, from 2014, okay? When you get this letter from the government, and it explains this is what your Part B premium is going to be and your income adjustment if you're in a higher income bracket, there's a paragraph in there that talks about an appeal process. If you're no longer making the income, the higher income, if you had a windfall 2 years ago, you sold a business, or you're just no longer making that much income, you can appeal the Part B premium tier that they put you into and get, adjusted back to where you should be. So, any other questions on the Part B premiums? Okay, Part D premium. So again, this is for the drug card. There's the same table, so the same tiers of income, but there's an income adjustment premium you have to pay the government on top of the drug card. Okay, if you're in that first tier, you don't pay anything additional for the drug card, but if you're in one of the higher income tiers, you pay an additional income adjustment to the government for your Part D drug card. Any questions here? Yep.
If you're under that, you don't have to pay nothing for the drug card?
No, you pay the plan. If you're in the first income tier, the $85,000 or below for single, or $170,000 and below for filing jointly, you just pay the plan premium for the drug card. Okay, the drug cards all have a premium that you have to pay for the drug card.
So you still pay something anyway.
You pay the premium for the drug card, yes. But if you're in one of the higher income brackets, you pay the premium for the drug card plus an additional amount that you have to pay the government. It's more, yes. No, this is not part of it.
If you have an income that's less than that 85,000 or below,
Yep.
and you get a Part D plan, how do those plan costs range from what to what?
Yep. So the question is, if you're in that first income bracket, 85,000 or below, what do the Part D drug cards generally cost? Okay, and we're going to get into, we have a whole section on the prescription drug plan, but just a quick answer, majority of people will pay between $20 and $30 a month for that premium for the drug card. Okay, it's not everybody, and we're going to get into the analysis that needs to be done to determine the right drug card, but just as a quick answer, the majority of people are in that $20 to $30 a month for the drug card. Okay? Another question, yes?
What happens if you're married and one person is in this situation, but your wife is younger and is not? So it's not. So would it be filing under individual?
So the question is, if you're Medicare eligible and your spouse is younger, not yet Medicare eligible, this is based upon how you are filing your taxes. So it's irrelevant whether she's or he or she is Medicare eligible. If you're filing your taxes jointly, then that's the number to use. If you're filing single, then use the single column. Okay. All right. Any other questions here? So when should you sign up for Medicare? Anyone?
3 months before.
Yeah, we generally recommend it's about 3 months before your 65th birthday for most people. We're going to get into exceptions on the next slide. But for most people, if you're no longer working, you're going to sign up. You have a 7-month window that starts 3 months before you turn 65. It includes the month you turn 65. and then 3 months after you turn 65. This is your initial enrollment period for Medicare, okay? If you do not sign up during this period and you don't fall into one of the exceptions we're going to talk about, there's penalties associated with not having your Part B of Medicare. Does anyone know what those penalties are? Right. There's a 10% penalty on your Part B premiums for every year that you do not have Part B when you're supposed to have Part B. Okay, it's not a one-time penalty of 10%. It's not a 1 month or 1 year penalty. You pay that for the rest of your life. So if you wait 3 years and then sign up for Part B, it's a 30% penalty on those Part B premiums for the rest of your life. And as those Part B premiums increase, your penalty is also going to increase because it's a percentage of the premium. Okay, so this is one. Yes, there's a question.
I'm a bit confused about what you just said.
Huh?
I'm still working. I'm not on Medicare yet, but I am collecting Social Security. Am I going to fall into that penalty box?
No, you're one of the exceptions. I said there were exceptions. So I said for the people that are not working or not on a group coverage plan like your spouse's plan, this is the general situation for people that are turning 65. On the next slide, we're going to get into specific situations for people that are continuing to work or on a retiree plan or on COBRA coverage. But this is for the majority of people that aren't, if you're not working anymore, this is when you need to sign up. Even if you fall into one of those other situations, however, you're still eligible for a penalty if you don't sign up when you're supposed to. So when you lose that group coverage, when you leave the company, if you don't sign up for the Part B of Medicare when you're supposed to, that penalty could still eventually apply to you. So we'll get into that shortly as well. So, yes, question.
Like every year? Or is it just, let's say that for a time, would be 10% of that. Is that constant or goes up?
It's 10% for the rest of your life. So you're going to pay that 10% on the 104.90. If the next year your Part B premiums go up to 121.90, you pay a 10% penalty on the 121, and then it goes up, and you pay that penalty the rest of your life. So this is why, and you're going to see these stars on top of the slides, the top 5 biggest mistakes we see. This is the number 1 biggest mistake we see people make, and it's with regards to volume and also with regards to the impact of the mistake. This is the one we see that has the biggest impact on people. Yes?
From my father, so I know that when he was 65, he was collecting Social Security, so his premium was paid from withdrawn from Social Security.
Yep.
My case, I can't collect Social Security till I'm 66 in 2 months. Do I have to start paying the premiums out of pocket at 65?
Yep. So the question was, the gentleman's father, when he initially signed up for Medicare, he was taking Social Security at age 65. If you're taking Social Security at age 65, you automatically get enrolled in Part B of Medicare. And if you don't want Part B, you actually have to disenroll from Part B of Medicare if you're taking Social Security. Okay? If you're not taking Social Security, then you need to sign up, then you need to actually sign up. And there's multiple ways of doing that. You can do it online on Medicare.gov. You can do it at a Social Security office. But if you're not taking Social Security, you need to actually physically sign up for Part B. So.
And premiums are out of pocket?
And yes, the premium question. So you'll get a bill from Medicare essentially for your Part B premiums that you have to pay until you start taking Social Security.
But what you asked was, like, for me too, my age would be 66 something. It's not 65 for Medicare, even though I don't get Social Security.
Absolutely, absolutely. The age for Medicare is 65, regardless of your Social Security eligibility date. So, yep.
Oh, that's changed.
Yep. So.
Some people that get Obamacare, then that, once you get to be 65, your Obamacare would stop and you never get.
Yeah, the question. Yeah, the question is for people that are under 65 that are on Obamacare. Yes, once you turn 65, you can no longer have an individual Medicare plan. I'm sorry, individual medical plan through the exchange or any other mechanism. You have to go on Medicare at the point in which you turn 65. It's illegal for an insurance company to sell you an individual medical plan at age 65 when you're Medicare eligible. It wouldn't be an individual plan. That would be a group plan. Yep. So we have extra handouts. Are there people that didn't get the handouts? I know we had some people come in late. You just raise your hand if you don't have the... Okay. So as far as the effective date goes, so we talked about the 7-month window that you have to enroll, and you can enroll up to 3 months before your 65th birthday. The effective date will be the first of the month you turn 65. Okay, so in this example, if your birthday is September 10th, your effective date for your Part B of Medicare will be September 1st, and you can enroll as early as June 1st. Okay? And there's some weird rule, and there's no logic for this, but if you happen to be born on the first of the month, you get an extra month of eligibility. So if you were born on September 1st, your effective date would actually be August 1st for your Part B. It must have been a congressman's birthday on the first of the month, and he wanted to get that extra month of coverage. Any other questions on the enrollment period, initial enrollment period? We're going to get into the exceptions in a minute. Yes? Mm-hmm. Mm-hmm. No, you do not. So that's actually the exception. So the question is, if you're working full-time and you have Part A of Medicare and you have a group health plan, do you have to sign up for Part B of Medicare? And the answer actually is it depends. So it depends on the size of the company that you're working for. Okay? If you're working for a small company, less than 20 employees, the answer to the question is yes. You need to have Part B of Medicare, because Medicare is primary when you work for a company that's less than 20 employees. You can keep your group plan as a secondary if you want to. It doesn't make sense in most cases. But if you work for a company that's less than 20, you need to have your Part B of Medicare. If it's a larger company, more than 20 employees, then your group health plan can be a primary payer. So you do not need Part B of Medicare. Okay, so that's the first 2 rows in this table, what we just talked about. Any questions on those 2 examples or exceptions?
Private plans usually require you to take Medicare to one level. You reach that threshold?
I'm not sure I understand. When you say the private plans, what do you mean by the private plans?
Or you say a union plan, if you reach the threshold where you're eligible,
No.
one they kind of push you into.
Yep. So the question is, so if you work for a larger company, and the union was an example, but any large company, and you reach Medicare eligibility, and you're still working, the question is, can they force you to go on to the Medicare plan? And the answer is no. It's actually prohibited by CMS and Medicare for a large employer to either incent an employee or pressure them into leaving the group plan to go on Medicare.
Well, not leaving it, but doesn't Medicare pay for it?
Nope. That's what this is right here. So if the company's larger than 20 employees, the group health plan pays first. If you're an active employee,
It's not my area. That's the question.
no, it's a fair question. But if you're retired, that's a different row on this table. It's towards the bottom here. If you're on a retiree plan, then Medicare is primary, and you need to have Part B of Medicare. Okay, so there's a distinction between active working and retired. So there was a question somewhere. I thought I saw a question. Yes.
He's falling into that disabled
Mm-hmm.
of the 100 employees.
Mhm.
He just got approved, but he's still on long-term disability until 66. So would 2 years being on Social Security be a requirement that you have to get Medicare, or does it go to age 65?
Okay, so the question is, and for folks that don't know, if you're on Social Security disability for 2 years, then you become eligible for Medicare. Okay, so the question is, if you're on Social Security at age 64, it starts, and then you're waiting for those 2 years to expire.
At 62 now,
Okay.
and he's got the 2 years now.
Okay, so then at 64, he'll become eligible for Medicare. Okay, so you're going to have an eligibility at
Yeah, right now, 62, and he's been on disability for almost 2 years,
Okay.
Social Security. So pretty soon, he's gonna be up to those 2 years where Medicare.
Yep. So again, it's a 2-year period. If you're on Social Security disability, you become eligible for Medicare after 2 years, really regardless of your age. So at 60, if it was 62, then at 64, you'd become eligible for Medicare. Okay. Right. So in that case, you look at the size of the company. So if the company is less than 100 employees, it's more than 100. So if it's more than 100, then the group health plan can be the primary insurance. They cannot make you go off and go on Medicare. So, yep.
And then at 65, it's up to you.
At 65, and even at 64, it would be up to you. You can still, it may be more cost effective. I don't know what your contribution is for the group health plan. So you'd have to look at all that to see what's most cost effective. Yep. No. Any other questions? Yes.
Then they go into Medicare Premium at 64, and they're not working. Do they have to reapply to Medicare when they hit 65, or?
They do not need to reapply for Medicare. They will get, and we're going to talk about Medicare supplement shortly, but when you initially go on Medicare, you get a 6-month initial enrollment window for a Medicare supplement where you can get any Medicare supplement you want without medical underwriting, okay? In that situation, you're going to get a new open enrollment period when you turn 65 for the Medicare supplement, okay? But you don't need to you don't need to reapply for Part B. You already have the Part B at 64 in that case. Right. Right.
So they don't have to reapply when they.
Correct. Okay. Any other questions here? We didn't talk about COBRA. That's actually one of when I say talk about the biggest mistakes people make, this is one that we see very often where people don't understand when you're on COBRA coverage. COBRA basically is continuation when you leave an employer and you keep the group benefits. If you are Medicare eligible, you need to have Part B of Medicare when you're on COBRA is not a primary payer. This is a major issue we see frequently. We were actually in Washington last week. We're part of a National Health Underwriters Association lobbying against some changes we want for Medicare to protect people. And this is one of the top issues that we're lobbying for. But people that are on COBRA, it's not a primary payer. So if you have if you're 66 and you're on COBRA coverage and you don't have Medicare Part B and you go to the hospital, the insurance company doesn't have to pay for your claims. Okay? That's the first issue. Okay? The second issue is you're given it's called an 8-month special enrollment window when you initially go on COBRA to go sign up for your Part B of Medicare. People don't know this. HR departments don't communicate this in a lot of cases. Okay? So people think they have COBRA and they can just keep it for the full 18 months with no issue. Okay, so what happens is, and let's just use the worst case example, if someone's 18 months of COBRA runs out in April, okay, they're going to go down to Social Security and try and sign up for Part B of Medicare, and Social Security is going to say, oh, you missed your special enrollment window. You had 8 months from a year and a half ago. You need to wait until our general enrollment period, which is January 1st to March 31st of the following year. Okay? It gets worse. So they wait their 9 months. Now they have no medical coverage. Okay, so for that 9-month period, no medical coverage. You can't go buy an individual medical insurance plan. It's illegal. You're over 65. The insurance company can't sell it to you. You can't buy it. So now you don't have coverage for 9 months. You go to sign up for it in January. They let you sign up. What's your effective date? Well, we're going to get to the penalty, but your effective date is not until July 1st of that year. So essentially, you've had 15 months from this. Again, this is the worst case scenario, but April is when the coverage ran out. You have to wait till January to sign up, and the effective date is not until July 1st. So this is why this is the biggest mistake we see. And I didn't even mention the 10% penalty, which that's at the bottom of the list. I mean, that's, after all those other issues you've had. So anyway, if you know anybody that's on COBRA or thinking about COBRA and they're Medicare eligible, please have them talk to a specialist or get signed up for Part B of Medicare. It's very important. Yes, question.
My question is, we have a Medicare we get our supplemental through that.
Yeah.
Now, if they should stop giving us that supplemental, now we have to go through complete physical and everything, or how does that work?
We'll get into, so the question is, so a retired situation, retired, right? Where they've got Part A and B, and then the company's basically, it's a retiree plan essentially, where they're paying for the secondary coverage. And then the question is, what happens a year from now, 2 years from now, which a lot of companies are doing, where they cut the benefits? Do we have to go through medical underwriting at that point 2 or 3 years from now? The short answer is no. There's something called a guaranteed issue situation, which you would fall into in that situation. You're not eligible for every supplement that's out there, but there's certain supplements you'd be eligible for without medical questions. And we'll get into which ones you'd be eligible for without medical questions. Yes?
Question on the COBRA. Did you say that if you're on COBRA and Medicare eligible, you have an eight-month window to?
I shouldn't have told you that, but yes, and I'll tell you why. So there's something called the special enrollment window, which is an 8-month window. If you start COBRA coverage, basically you've left the company, your group coverage ends, you have an 8-month window from that point to go sign up for your Part B of Medicare. Don't use, if you're in that situation, do not use the 8 months. Remember what I said, COBRA is not primary coverage. So you technically have 8 months to go sign up for Part B, but the insurance company that's your COBRA provider does not have to pay your claims because Medicare is primary. So yes, you have 8 months to go and sign up for it, but you should do it right away because it's, your COBRA coverage is basically useless without Part B of Medicare. This is clear as mud, right? Yes. Yes, okay.
My intent is to retire in May, next May, not this one, next. And October 1st, through the month of October, apply for Medicare. Is that enough time? I have 7 months then. Is that enough time?
The question is, if you're planning, you're planning to retire May 1st of 2017?
Yes.
And you don't need to apply as early as October. No, you could apply, in March, April of 17. And I wouldn't recommend applying early unless for some reason you want to leave the group plan early. But it doesn't take 7 months to process everything. I was just saying you have a 7-month enrollment window when you turn 65. That's the 7-month initial enrollment window.
When I turn, what age? Did you say?
65, that was the initial enrollment. The 7-month window doesn't apply if you're in your situation is what I'm saying. Okay, it'll only take, we generally recommend about 6 weeks before, if you're planning to retire, start the process, make an appointment with Social Security. There's 2 forms you need to fill out. One, if you're in that situation, one, you're saying I want Part B effective May 1st. The other one is the employer filling out saying you have proof of coverage. So you don't get penalized for your Part B, not having Part B. But that whole process, 6 to 8 weeks is fine before your retirement date, not the 7 months. Other questions here? Okay, so when you go on Medicare, you have 2 high-level choices you can make, or 2 paths you can take with Medicare. Okay, the path on the left side, yeah, it's left, is original Medicare. Okay, so this is that Part A and Part B of Medicare. It's provided by the government. You can then supplement that with a Medicare, Medigap or Medicare supplement plan, and also get a prescription drug card. Okay, so that's one option you can take. The other option is the Medicare Advantage plan, which is also called Part C of Medicare. And this option is a fully privatized plan. Okay, so the insurance company fully manages your benefits for Part A and Part B, and also the drug card in most cases underneath the Medicare Advantage plan. Okay? So, and let me just jump to the next slide because I'm going to walk through the differences between those 2 paths. With a Medicare Advantage plan, it's essentially replacing Part A and Part B of Medicare, where a Medicare supplement or Medigap plan is supplementing Part A and B of Medicare. Okay, so there's a distinction there that's important. Okay, the Medicare supplement, even though the supplement is provided by a private insurance company, it's not replacing your Part A and B benefit. It's just supplementing or filling the gap that's not covered by Medicare. Okay, Medicare Advantage, on the other hand, is a full replacement. Your benefits are no longer managed by the government. They're now managed by a private insurance company. The second row here, private network required. So Medicare Advantage, for the most part, are HMO plans. So in an HMO, you need to stay within the private network that's offered by that insurance company in that service area. With original Medicare and a Medicare supplement, you can go to any doctor or hospital in the country that takes Medicare. So it's about 90% of doctors, 98% of hospitals accept Medicare. Okay? Referrals. So with a Medicare Advantage plan, again, it's an HMO. If you want to see a specialist, the chiropractor, the podiatrist, you need to go to your primary doctor, get a referral to go see the specialist. With original Medicare, you do not need referrals. If you want to see a specialist, you just call up the specialist and make an appointment. Part D, remember, that's the prescription drug plan. Okay, with most Medicare Advantage plans, that's included. Okay, if you go original Medicare with the Medicare supplement, the drug plan is not included. That's a separate card you need to get, and we'll talk about that later on the Part D of Medicare. Monthly premiums. For the most part, Medicare Advantage plans have lower premiums than Medicare supplements. Okay, and this is, if there's any reason people generally go with a Medicare Advantage plan, it would be because of premium in most cases. The annual out-of-pocket costs on a Medicare Advantage plan have a maximum up to $6,700 per year. Okay, with a Medicare supplement, I'm going to show you a few examples tonight, but they could be as low as zero out-of-pocket. Maybe, well, I'll show you one that's like $166, and there's one that's a little bit more than that. Okay, so there's a big difference in the level of coverage as well between the two. And then guaranteed renewable for life. So Medicare Advantage plan, essentially every year there's an open enrollment period between October 15th and December 7th where you need to look at the Advantage plans for the following year. You could potentially keep something similar to what you have, but you may have to change the coverage, the deductible, the premiums. All of that could change every year with the Medicare Advantage plan. With the Medicare supplement, it's federally regulated coverage. So the coverage will never change. You're guaranteed renewable on that coverage for the rest of your life as long as you pay the premiums. Question? Yes.
So how often does Part C change? I understand it's on a county-wide basis.
Yep.
It's controlled by the state on a county level.
So the question is, how often does Part C change? It's controlled by the state. It's really controlled by the insurance companies that need approval by the state for each of the plans that they set up. But the insurance company forms and designs these plans. It's a fully private insurance plan, so they can add benefits and remove each and it's how often it's each year, once per year. October 15th to December 7th is when you can enroll for the following year. So they change potentially once a year.
So the plan could change from year to year.
Yes, absolutely, and it does. I mean, this happens pretty frequently where people potentially like a plan that they're in with the Advantage, and then they come around the following year and it's no longer available. And in some cases, the insurance company will map you into the next logical choice. In other cases, you have to make an election. But the bottom line is they change pretty much every year with the Medicare Advantage, where Medicare Supplement, once you get in that coverage, it's federally regulated. It'll never change the coverage. Yes?
You're in, say, traditional Medicare and switch to the Advantage. Can you go back and forth every year?
We're going to get into some of the, so this gets into underwriting. The question is, if you're in traditional Medicare, traditional to Advantage or the other way, which one did you ask? Original Medicare, and you want to go to a Medicare Advantage plan, you can do that every year if you want, between October 15th and December 7th. Okay, so there's no underwriting for a Medicare Advantage plan. Okay, if you're in the opposite situation where you're in a Medicare Advantage plan and you're more than 6 months from your Part B effective date, so you've been on Medicare for some time, in order to switch into a Medicare supplement, you'd have to go through medical underwriting. which is essentially it's depending on the carrier, it's like 10 to 12 questions that you have to be able to answer no to in order to get into a Medicare supplement.
Under Medicare Advantage plan, if you need to go to say a surgery, a special surgery, and the plan doesn't cover it, do you have to pay out of pocket?
Yeah, the question is if you're on a Medicare Advantage plan and you want to see a specialist or a doctor that's not in the network, then it's not covered by the network, then yes, you'd be paying, out of pocket. So that's another thing. So yes, the doctors can leave in the middle of the year of the network. They can't really control whether or not a doctor stays in for the full year. So that's true. Yes.
I just see a commercial on TV, I think it's in New York, it's a Blue Cross Medical Advantage, and they advertise it like 0 premiums and 0 out of pocket, but this, because the commercial's on all the time, so it's not really out of pocket 0.
I haven't seen that commercial, but there are a lot of Medicare Advantage plans that are 0 premium, and that's what people gravitate to, because it's no out of pocket for the premium. There's up to, depending upon the plan, the maximum could be up to $6,700 out of pocket with Medicare Advantage. So it's yes.
Getting back to that medical, you said, is it typically more or less with the federal government, or it also varies state by state?
I'm sorry, what was the question?
No, when we're talking about the medical stuff, it's federal, correct? It wouldn't vary any difference from state to state,
Like if you
would
lived
it?
in Florida versus New Jersey.
I'm not. Medicare costs, Part A and B, like the Part A. Oh yes, Part A and B would be, they're federal, so those are regardless. No, correct. The Advantage plans will vary by service area, which could be a county. So you're going to see all over the state as well as the country, you're going to see different rates and different coverage for Medicare Advantage. Medicare supplements also vary by state, and sometimes, like Pennsylvania, it's by zip code. So yeah, those pieces will vary, but the pieces you pay the government, well, they change every year, but they geographically they're the same.
Along with that, if you're on an Advantage plan and you travel to another state and you needed surgery, are you covered?
So generally, no. If it's an emergency and you need to go to the hospital, yes, you'd be covered for an emergency. But if you're going for, routine surgery and you're outside of the network, then no.
That's not true.
What's that?
That's not true.
Okay.
At that time we had the lights went out, had an emergency. My sister lives in Pennsylvania. She was at my brother's in New Jersey. She slipped down the steps, no lights, broke her foot in 3 places. I'm trying to think of the name of the insurance company. They would not cover New Jersey.
Okay. Yeah, I don't know that exact situation and what the company was and what the situation. The example was there was an emergency situation where, and are you sure it was a Medicare Advantage plan? This was.
I think she had an advantage.
Okay. And it sounds like they wouldn't even pay for it in an emergency. So it's, my understanding is if it's an emergency and you're outside the service area, there's exceptions where they will provide some coverage, but it's not generally the rule. So.
She did go through a rigmarole and explain the whole situation. So eventually she got coverage. I don't know if it was all of it or not. And then my brother's insurance had to pay for part of it.
Okay. Yeah, that's. So any other questions on the difference between these two paths, original Medicare versus, yes? Yes.
What would make the county more or less?
The cost of care. The question is what makes the cost vary in a Medicare Advantage plan from one county to another, and it's the cost of the care. So in the Medicare Advantage, remember, it's an insurance company that they're for-profit business, right? So they're looking at the cost on the back end. What are they paying the hospitals? What are they paying the doctors? And determining a premium that they need to charge in order to pay off the cost and make money. So.
Because you're in Union County, wouldn't you go to a hospital in Union County?
Well, no, that's what these are HMO plans, so you have to go within that service area. You have to stay within it if you're in a Medicare Advantage plan. So, any other questions here?
Medicare Advantage plans are always HMOs?
In most cases, there are certain carriers that advertise PPO. There's one carrier in particular that got into some trouble this past enrollment period, advertising this Medicare Advantage plan that you could go to any doctor that takes Medicare. I won't mention the carrier now, but it turned out to be a problem, and they couldn't go to any doctor. In most cases, they're HMO plans. Some of them offer PPO, but we've heard of issues with some of the PPOs. So, another question? Yes.
You have original Medicare and you decide you're going to go to a Medicare Advantage plan. Every year you have to more or less re-enroll?
More or less, yeah. Because these plans change Medicare Advantage plans change every year. So if you enroll, so let's say this October you roll for 2017 into a Medicare Advantage plan. October of 2017, that plan is most likely going to get changes for 2018. And so they're going to send you a 40-page book of all the things that that are covered in that plan or that change in that plan. You can accept to keep it or potentially change to a different plan, or they may cancel that plan and they may say we're no longer offering this plan. But the Medicare supplements, they can't do. These are federally regulated coverage. They can't change. Once you're in, you get to keep it. So, yes.
In private insurance, you have usually there's a maximum out-of-pocket cost, and then they start to pick up 100%. Like if they pay say 90% or something. Is there a maximum out-of-pocket for original Medicare?
So the question is there a max amount of pocket for original Medicare with a supplement? If all you have is original Medicare, the answer is no. So if you just have Medicare without a supplement, there's no max out of pocket. You pay essentially 20% with no max. If you have a supplement, and the ones I'm going to show you tonight, the max amount of pocket is minimal. Depending upon which one you go with, it could be 0, or it could be, like I said, 166. I'll show you one, and there's a couple others too. So, all right, I want to keep rolling here. The last comment on this slide, this is the third biggest mistake we see people make, is not fully understanding the differences between Medicare Advantage and a Medicare supplement, original Medicare. All right, I'm going to just get into, I talked about Medicare supplements or Medigap plans. I'm going to go over just 3 of them for the sake of time here. These are the most popular that we see people when they go to enroll in a supplement. Plan F, which is the most expensive plan. It's also the most coverage you can get right now. We're going to get into what the F covers. Plan G, which is the next plan below the F. We're going to talk about what's covered with a Plan G supplement. And then there's a plan called Plan N as well, which is another Medicare supplement that's slightly less coverage, but also a lower premium than a G as well. Okay? So first, under Plan F, Medigap plan. Okay, this is for Part A of Medicare. Okay, so this table shows what is Medicare paying, what is the supplement paying, and most importantly, what would you pay if you have a Plan F supplement? Okay, if you get hospitalized, for the first 60 days in the hospital, there's a deductible with Medicare. It's $1,288. Okay, if you're in for more than 60 days, Medicare has a copay of $322 per day. And if you're in for more than 90 days, that copay goes up to $644 per day in the hospital. So if all you have is Medicare, you'd have to pay that $1,288. If you're in for longer, the $322 a day or the $644 a day. If you have Medicare Supplement Plan F, it'll pay that $1,288 deductible. It'll pay the $322 copay per day, and it'll pay the $644 copay per day if you're in for more than 90 days. So if you get hospitalized, what do you pay? Right, there's really no out-of-pocket if you get hospitalized with the Plan F supplement. In addition to that, Medicare provides a lifetime reserve of 60 days if you're in the hospital for more than that 90-day stay. Okay? The supplement will provide an additional 365 lifetime reserve days on top of the 60 that Medicare provides. Okay? If you get transferred to a skilled nursing facility care as part of that hospitalization, so you have to be admitted to the hospital, there for 3 days, and then transferred into skilled nursing facility care, Medicare is going to pay for the first 20 days in the nursing care. After day 20, there's a copay of $161 per day if all you have is Medicare. If you have the Plan F supplement, it'll pay that $161 per day. And what do you pay? Zero. Up to 100 days in skilled nursing care, you'd pay zero. So, under Part B of Medicare, again, Part B is everything that's outside of the hospital, essentially. Your doctor's visits, your x-rays, your testing, outpatient surgery, chemotherapy, kidney dialysis, preventative services, all of that falls under Part B of Medicare. There's a deductible under Part B of Medicare. It's $166 this year. Okay, after the deductible, Medicare is going to pay essentially 80% of your expenses under Part B of Medicare. If you have the Plan F supplement, it'll pay that $166 deductible. It'll pay the 20% that's not covered by Medicare. And what do you pay? Zero. There's also something called excess charges. Okay, this essentially means doctors can charge up to 15% more than the Medicare approved amounts. Okay, this isn't something they can randomly do. They can't just pick a patient and charge them 15% more, or pick a diagnosis code. It's really across the board, and they have to make an election over a period of time that they're going to charge this extra excess charge up to 15% more than Medicare. There's 2 supplements that'll pay for that. So you don't have to worry about it with a Plan F. It'll pay for that excess charge. And the one I'm going to show you next, which is a Plan G, will also pay for excess charges if the doctor charges excess charges. This is actually prohibited in certain states: New York, Pennsylvania, Florida, not New Jersey. Here's what I would say. They absolutely, if you ask them, they have to tell you they're going to charge the excess charge. I wouldn't be as confident to say they're going to proactively notify you that there's going to be an excess charge. So I would, if you don't have either an F or a G, before you get the treatment, I would recommend asking, if that doctor charges the excess.
Well, yeah, because there was a controversy, and it had to do with when you were having going into the hospital, okay, and the doctor, he's going to be covered, but the person that's going to be providing you with the
anesthesia
anesthetic is not covered, and they don't tell you, then you're stuck paying the bill. So my question would be, is it by law that they have to tell you that they're not covered?
Well, the question is, and this is actually not just specific to Medicare. We've seen this in pre-65 insurance as well. But essentially, you're having a procedure done in a hospital. The surgeon's covered under the network, but the anesthesiologist potentially isn't, and you get a big bill from the anesthesiologist. I don't have a clean answer for you. I can tell you that this is an active issue that's being looked at, and it's really handled on a case-by-case basis. If the individual isn't notified about the anesthesiologist, they can work through the insurance company and have something worked out, and we've seen it where it's been successfully paid for. But in a lot of cases, they do get a bill first from the anesthesiologist. Some people are just going to pay it and not fight it. And unfortunately, there isn't great communication up front in that situation. But that's not really a Medicare-specific issue. We've seen that just across the board with that situation. So, yes.
Do you take Medicare assignment? That would assume that they take what Medicare offers, right?
Yeah, I would be careful. The question is, if you accept Medicare assignment, then you do not charge excess charges. And technically that's correct. I would be careful with the terminology, because the doctor could say, yes, do you accept Medicare? Is different than do you accept Medicare assignment? Okay? So some doctors don't even want to be a part of the system at all. They don't accept any Medicare. It's rare, but actually in New York City it happens. But just be careful with how you ask the question, if that's the way, do you ask it correctly? Okay. But the doctor may say, yes, I take Medicare. And that's not the same answer as, are you going to charge excess charges is a different. But I guess the big takeaway here is if you have the Plan F, you don't really have to worry about that, or Plan G. It's one of the other supplements where you need to be aware of that. Yes?
So prior to surgical procedure, if you asked them about the anesthesiologist, they would be obligated to tell you whether he was covered or not.
Yes.
The thing is, you need to know to ask that
Yes, yes, and chances are that's the last thing on your mind when you're about to get the gas and, oh, by the way. But yes, if you ask, they have to give you an honest answer. Yes.
Hasn't it also worked out similar with other insurance too, with like you go in a hospital and the lab work that they draw on you doesn't go to the labs that's under your insurance?
Sure.
And you get charged for that, so you have to always keep on top of it.
Yeah, this is a question that's not really a Medicare specific question, but if you're on different insurance and the lab work gets sent out to a lab that's not covered, you would get a bill for that, and you can fight that as well. There's ways if it wasn't in your control where it got sent, but that's with Medicare that you're not going to run into that sort of situation. So, you had a question, sir?
Yeah, I know someone who went to a dietitian recommended by their doctor. And they took the Medicare in other words, the card and everything. But then later on, they let them sign a form where if there's excessive charges, they would be responsible for those. Are they still responsible?
It depends what plan they have. So the question is, no. With the F, the secondary carrier is going to pay for the excess charges. Yeah. All right. Any other questions on the Plan F coverage?
So that's the best one to get.
I won't say that. I'll say that's the most comprehensive coverage that's available. Okay? I'm going to show you just another supplement plan out there. Is called a Plan G Medicare supplement. And Plan G is exactly the same as a Plan F, except for one difference. The Part B deductible is not covered by Plan G. Okay, that's the only difference between the F and the G. So if you remember from the F, the Part B deductible, it's $166. Okay, so if you have a Plan G and you go to the doctor, you're going to pay the first $166 under Part B once per calendar year. After you pay that deductible, everything's fully covered just like the Plan F was. Okay. Why would anyone go with a G versus an F? Exactly. What's that? No, it's the premium. So even if you're not invincible and you have conditions, in almost all cases, at least in New Jersey, in almost all cases, the G is going to be a lot less expensive than the F, and you're going to save anywhere from $250 to we've seen people save $1,000 a year on their premiums from a F to a G, depending upon which carrier you have, with the F or the G. So it's generally a really good value. The other thing to be aware of, there was legislation passed last year in March or April, and it was a sustainable growth for Medicare. And there was a lot of provisions in this bill that had to do with how doctors get paid on Medicare. But towards the bottom of this bill, there was a provision that says starting January 1st of 2020, there will be no more Medicare supplements that cover the Part B deductible. So there will be no more new beneficiaries won't be able to get a plan that covers the Part B deductible. So what does that mean January 1st of 2020? If you have a Plan F, what did I say earlier? It's guaranteed renewable for life. So they can't take it away from you. You can keep it. But if you're new to Medicare, starting in the year 2020, Plan F will no longer be available for you to sign up for. So in the year 2021, the youngest person in a Plan F will be 66. In the year 2025, the youngest person will be 70. Okay? The premiums for these plans are determined by the claims costs associated with the plans. So the theory is, starting in the year 2020, that the Plan F premiums are going to be rising at a greater rate, and they all go up every year, but at a greater rate than some of the other plans, because the youngest person in a Plan F will no longer be 65, they'll be 66 or 67, 70. So these are some things just to think about. If you have an F, you can absolutely keep it. They can't take it away from you, but there'll be no more young blood coming in the year 2020 to kind of bring down the overall costs of the plan. So, yes.
Medicare Part A, and I have F supplement. Is there a limited number of how many times you could be admitted
No. Now the question is, if you're on Medicare and you have the supplement Plan F, is there a limit to how many times you can be admitted to the hospital? No, there's no limit on that. So, is there? No. Any questions on F or G, Plan F or Plan G?
So the only difference between Plan G and Plan F is that $166.
That's the only difference between the F and the G is the Part B deductible.
But then,
Difference in the premiums.
Well, right, but the coverage, the only difference in the coverage is the deductible. Yeah, the premium will be lower with the G. Yes.
but then when 2020 comes around,
Hmm?
then that's not so good in the end.
The F plan, there are no, in the year 2020, if you're newly Medicare eligible, you won't be able to get a Plan F. The G will still be available because it doesn't cover the Part B deductible. So, yep, there was another, yes. Sure. No. The question is, if you have a Plan G and you want to switch to another carrier that has a lower cost Plan G, or forget about the plan. If you have any Medicare supplement and you want to switch to a different Medicare supplement, different carrier, you can do that anytime throughout the year. You don't have to wait for the open enrollment is only for Medicare Advantage and prescription drug plan. However, you have to answer medical questions. That's the medical underwriting we talked about earlier. So.
And the medical questions are like what?
It depends on the carrier, but they're looking for major, medical conditions, recent hospitalizations, upcoming surgeries, physical therapy, dementia. It's kind of across the map looking for things that would be expensive for the insurance company.
And so then that's what they'll base your premium on?
No, it's a yes or no. Yes or no. If you can't answer all the questions no, you can't even submit an application. So the premium is what it is. Let me caveat that. There's certain carriers that have different rated premiums, but for the most part, it's a yes or no situation. So, yes.
My sister has been on Medicare. She's on Social Security Disability, so she was younger than 65. And she's been wanting to get this AARP supplemental plan, and she's like, oh good, I'm going to be 65 this year, I can get it. Do they limit by age some of these F&G plans?
Okay, so the question is, someone's on Social Security Disability, they're under age 65, they're Medicare eligible, and they want to get a Medicare supplement. There's actually only one Medicare supplement that you can get in New Jersey in that situation. It's not a carrier, it's the plan, it's called a Plan C. Okay? If you're in that situation, that's the only supplement you can get. Plan C is actually a really good plan. It's very similar to an F. The only difference between an F and a C is C does not cover excess charges. Okay? I don't have the C up here, but it's exactly the same as an F, except for it doesn't cover excess charges. So that's the only plan you can get if you're on Social Security Disability before 65. Once you turn 65, you get another open enrollment period, and you can get any Medicare supplement you want. So when she turns, she can get, yep. Yes?
I missed the beginning of somebody's question, but did you say you changed from an F to a G? You have to answer those questions, health questions?
Yeah, if you're switching from one carrier to another, it depends on the carrier. There's certain carriers, if you're going from an F to a G, they'll let you do it without medical questions. But in most cases, if you're trying to save money, most of the time you have to switch to depending upon the carrier, you'd have to switch. But it's been at least 5 years. It's been around for some time, yeah. Yes?
I'm going to be 65 in November.
Yep.
Now, if I remember correctly, last time I had a medical records for my health care coverage, I think it was last October. I think there's a part in there where they actually asked you if you're going to become Medicare eligible.
Okay.
If that happens, now I'm with United Healthcare, and say I go with Plan. It's my understanding, like she was saying with AARP also goes with United Healthcare. But they say that United Healthcare really isn't the same United Healthcare I have, right? Is that true?
All right. You hold on. You just hit on a few different points. So let me ask you a clarifying question before. So are you retired or working?
I'm retired.
Okay. So the question is, and you're going to be 65 next year? Okay. So retiree situation, you're under 65, you're on the retiree benefit. When you turn 65, you need to sign up for Part B of Medicare because Medicare becomes primary. The retiree, the company basically is providing a retiree benefit to you. It's a retiree plan, okay? It's a customized plan. It is the same United Healthcare insurance company, but the retiree coverage that's being provided, unless you're going to an exchange and signing up for a Medicare supplement, if it's a retiree plan, it's a customized plan. I don't even know if it's called a Plan G or what they call it because it's going to be customized for that company. So I don't know what the coverage is or what you'd have to pay for it, but that's one option. The other option is for you to get a supplement, which you could get through United Healthcare, which is AARP.
So, okay, so it is.
No. AARP is just an association and they sell Medicare supplements, and the insurance company behind it is United Healthcare. Okay? You're in a unique situation. You have a retiree benefit, and I don't know, without looking at the summary of benefits for your retiree plan, whether that's a standard Medicare supplement or some sort of customized retiree plan that your company's offered you.
So I'd have to find that out.
Right.
Or in November when
Yep. And you want to compare that, how much you're going to pay for that and the coverage, to just getting a supplement on the other market. Yep.
Okay. I guess that was my question.
Yep. All right. I want to keep it moving. I want to get to prescriptions. The last supplement I just want to tell you is the Plan N Medicare supplement I want to show you. And essentially an N is the same as G. So you still have to pay that Part B deductible. But after you pay the deductible, you have copays. So it's $20, up to $20 for the doctor, up to $20 for a specialist, $50 for the emergency room, and it does not cover excess charges. Okay? So those are between the F, the G, and the N, those are the most popular plans we see. About half the people that we see generally go with an F. More than that are going, G is becoming more popular, and then a small percentage end up going with the N from the people that we generally work with. So. All right, the Medigap open enrollment, I touched on this throughout, so I'm just going to very quickly here. You have a 6-month window from the original time you sign up for Part B of Medicare where you can get any Medicare supplement you want without medical underwriting. Okay? After that 6-month window, you have to answer those medical questions if you want to switch your Medicare supplement. All right, these are called supplemental guaranteed issue periods. Okay, so the question came up earlier. If you are retired and you have your Part B of Medicare and you're using the retiree benefit as your secondary, and then the company decides to change the retiree benefits, do you have to go through medical underwriting to get a Medicare supplement? And the answer is no. You're in a guaranteed issue situation, which means you can get that Plan F supplement without any medical underwriting. Okay? The Plan G is not a guaranteed issue plan. So if you want the Plan G and you're in that situation, you'd have to go through medical underwriting.
What if F isn't available?
And they're working on right now which is going to be the new guaranteed issue plan starting in the year 2020. So.
So if you jumped into F, because you could do that without the underwriting, right?
Yep.
Once you're in F, and you say, wait a minute, I want to save more money, I want to go to G, then you have to answer the questions, and you couldn't automatically pull it.
Yeah, the question is if you go into an F and then a year later you want to switch to a G, do you have to go in through underwriting? And the similar question was asked earlier. It depends on the carrier. If you stay within the same carrier, some of them will let you go from an F to a G without underwriting. But if you're going to switch carriers, which in most cases that's where you're going to save money going from an F to a G, is going from one carrier to another, you would definitely need to answer medical questions. Are the medical questions the same for all the companies? No, but they're directionally similar. So, just for the sake of time, I'm not going to go through this entire table. You should have it. Is it in the slides? Yeah, it should be in the printout. But these are just other situations where you could potentially get guaranteed issue for a supplement without medical underwriting. Okay? I want to get to the prescriptions. All right, so Part D of Medicare, the prescription drug plan. There's 4 steps within Part D of Medicare. Okay? So the first step of Part D of Medicare is the deductible. And it's up to $360 deductible for the drug cards. Okay? Doesn't mean it has to be $360. It could be $250. It could be $0. But the maximum deductible on a Part D drug card for this year is $360. Okay? After the deductible is where it gets a little confusing. There's something called the initial coverage level. Okay? This is up to $3,310 based on the retail cost of the drugs. As long as you're underneath that cap, you're going to pay copays or coinsurance for your drugs. So it's probably something similar to pre-65 insurance where you go to pick up your drug and you pay the $20 copay. So that's a copay essentially while you're underneath that cap. If you exceed $3,310, again, retail cost, not what you're paying, but retail cost. If you exceed that, you fall into the donut hole. It's also called the coverage gap. Okay? This is where you really start to pay a lot for your drugs. This year, it's 45% the cost of a brand name drug and 58% the cost of a generic drug while you're in the donut hole. Okay? So the example I like to give, because it's a little confusing, let's just say you're taking a drug that's a $500 a month retail cost drug, okay? Your copay for that drug is, let's just say, $30, okay? January, you go to pick up that drug, you pay $30, you go home with the drug. February, $30, you go home. March, April, May, June. You get to July, and you go to pick up that drug, $240. Excuse me? I mean, this happens a lot, and people don't understand what happened because the last 6 months I paid $30, and this month it's $240. Or whatever the math is, something around there. Well, that's a separate, I'll get to that in a minute. But when this happens, essentially, you're going to stay in that donut hole where you're going to pay the 45% for a brand name or 58% for a generic drug for the rest of the year unless you reach catastrophic coverage. Catastrophic is there to protect you. Okay, if you've exceeded $4,850 based on true out-of-pocket cost, this is not retail cost, this is a different metric, but if you exceeded that $4,850, then you pay the greater of 5% the cost of a brand name drug or $7.40 for a generic drug. Okay? So it's a little confusing, but any questions on those steps before I get to the formulary question? Yes.
So how does it work when Medicare is your primary and you have for drugs?
Okay, so I think we're confusing a couple of things. So a supplemental is for like a Medigap plan or Medicare supplement? Is that what you're... Medicare supplement is for Part A and B. You're supplementing what we talked about for hospital and doctors. It doesn't cover the drugs. So Part D of Medicare, this is Part D. This applies to all. There's 20 different drug cards in the state of New Jersey for Medicare. These 4 parts apply to all 4. This is just the structure in which they reside, essentially. Yes?
But if you have an advantage plan, it could supersede this, right?
No. The question is, if you have an advantage plan, does it supersede this? And the answer is no. This is Part D of Medicare. This is the 4 components within Part D of Medicare. Whether you have an advantage plan that has a prescription plan, these rules still apply to the prescription coverage within the advantage plan. Yes?
When we're talking about that 5%, so they're saying it's either going to be $7.40 or 5% of the cost?
Yes.
Whichever's greater.
Yes.
So you've got a $1,000 bill.
Yep.
5% of that $1,000, not $7.40.
Exactly. It's a greater of, which is a huge relief, by the way, because you're going to be going from paying $500 a month from that $1,000 pill to $50 a month. So it's still a lot, but it's nowhere near what it was in the donut hole. It's there to protect you. The other thing I'll say is this is getting better every year between now and the year 2020. So the percentage that you pay while in the donut hole is going to be dropping every year between now and the year 2020. It's going to go down to 25% in the year 2020. It's about 5% a year. It's going to keep dropping, 7% on the generics. And by the year 2020, if you hit the donut hole, you're going to spend 25% instead of 45% and 58%. Okay? Yes?
Through the PAD program, does Medicare take part of that? And
Yep. Good question. So there's a program, it's a phenomenal program in New Jersey. It's called Prescription Assistance for the Aged and Disabled. The acronym is PAD, P-A-A-D. Okay? And it's income dependent. So it depends on, I want to say it's if you're less than, I think it's $27,000 as a single or $32,000 a year as a couple, you qualify for PAD. PAD provides phenomenal assistance. They pay, in some cases, all of your premium for your drug card, and your copays can be as low as $5 for your drugs. And then there's also a program called Senior Gold, which is the next tier up. I think you can be up to $37,000 income, I think, as a couple, and you can qualify for Senior Gold, which would pay for a portion of your drugs. It's not as much as PAD, but that's a state program, and on the back end it works with Medicare as far as how it's covered, but it's a state by state.
They get the initial money from Medicare and then the other thing picks it up?
It's a state. The state is what's subsidizing it, but how it all operates, and it all depends on your income as far as how much help you get. PAD, P-A-A-D, Prescription Assistance for the Aged and Disabled. All right, so how do you pick the right drug card? There's 20 different options available. The tool we use, it's available to everybody. It's on Medicare.gov. And essentially what you do is you enter in the list of drugs, the dosage, the frequency, your preferred pharmacies, your zip code, and the tool is actually a phenomenal tool. It does all the analysis for you, and it's comparing all 20 of those cards based upon your drugs, your pharmacies, your zip code, and determining what's the best drug card for that specific list. And the way it's doing that, it's looking at the total overall expense. So it's looking at the premium for the drug card, plus the cost of the drugs in each one of those phases, and it's totaling it all up, and it gives you a number. And then it sorts that list of 20 cards, and the one at the top of the list is the one with the least overall expense for the year. Okay? Medicare.gov. Yep.
And what's it called again, the thing?
There's an option at the top. I think it says Find Health Plans, and then there's Part D Drug Plans or something like that. But it's all you'll find if you go to Medicare.gov. Yes, question.
Just making a joke out.
Yeah.
It's kind of like Priceline.com. Go there, and there's all the prices. What hotel, and what's the cheapest way you can get it at.
Yeah, essentially, the question was, it's like Priceline.com. But it kind of is. I mean, you enter in some information, it tells you all those 20 cards. It's got very detailed reporting when you want to look at how much your drugs cost on each one of those cards. If I go to CVS, what is it going to cost me? If I go to Walgreens, what is it going to cost me? It's a pretty great tool.
Even with different pharmacies.
You can pick different you can pick up to 2 different pharmacies each time you run it.
What do you do when you have a person whose drugs that they're taking is not stable? I ran this problem with my mom, that she was finding at the time when she had to choose a code, that her doctors kept changing her medication on a weekly basis.
Yeah.
I mean, to the point where she had 10 of them, and it was left.
Right.
In the next 2 weeks.
Right. So the question is, what if your drug list is not stable? It's changing frequently, or you just get a new drug prescribed in the middle of the year. The short answer is you wait till October the following year, and that's when you can reanalyze and pick a new card for the following year. Every year you can change your drug card between October 15th and December 7th. I'm sorry? The way we do it is we look at the list of drugs that you're on at that given time. And that's all the information. We can't predict the future as far as what you may or may not be prescribed. So we do the analysis based upon the drugs that you're currently taking and determine the best drug card for that list of drugs. There are exception processes It's not clean again, but there's ways if you get prescribed a drug and you've tried other drugs that are on the formulary and they don't work, or the doctor doesn't think they're going to work for you, and you get the doctor to write a letter and you can get exceptions approved, but it's not a simple, process. So.
Other, sometimes you can get 10 to 15%. If you're dealing with your insurance company and they collaboration with a group like us, for example, I can send out, and instead of paying locally, I send to this drug company, which is controlled by the insurance company, and they'll tell you if you go through them, it's the same drug, you save 15%.
So there's certain, I think the comment is there's certain drugs that are expensive, and there's pharmaceutical and insurance companies that have arrangements where you can reach out directly outside of the Part D program and look for some sort of discount. It's not something you'll find that's well documented as far as what those prices are and what those discounts are. But if you get prescribed an expensive medication, it's worth looking into to see if you can get a special discount going direct to the pharmacy in that case, or I'm sorry, to the drug company or the insurance company. Yes.
My sister had Enbrel for rheumatoid arthritis.
Yep.
It's ridiculous.
Yeah.
Expensive, not covered anywhere. The insurance company gave her grants to apply to.
Yep.
And then she gets it paid that way. 'Cause it's
Yep.
like $4,000.
Yeah, there's certain. Yeah, Humira is another one that's very expensive, $4,000 a month. So there's programs out there. We mentioned Pat earlier. If your income is in a certain level, there's ways you can go directly to try and get discounts. But there are some expensive drugs. For the sake of time, I have an example. I don't think we have time to go through. I'm just going to go to the summary just to highlight the importance of doing this analysis of your drug card. Okay, this was an example of an individual who came to us with a list of drugs. They were very expensive drugs, and he had a particular drug card that he wanted before we even did the analysis. It was Card A, and all he looked at was the premium, and he wanted to pay a $40 premium. I'm sorry, Card B. He wanted to pay a $40 a month premium for his drug card. And we ran the analysis. The best card that came up for him had a much higher premium, but the overall expense for the year, because his drugs were all covered, was much lower than the Card B. Okay, so the importance, this is the fifth biggest mistake we see people make, is not properly analyzing the drug card. And it's not just when you sign up, but it's every year during open enrollment or annual enrollment for the drug card, October 15th to December 7th, where you need to revisit and make sure you've got the right drug card for the following year. All right. So I'm just going to quickly recap the top 5 mistakes people make. We went through these throughout. The first one is not enrolling in Part B of Medicare when you're supposed to. Remember, there's the 10% penalty. And then the COBRA, if you're on COBRA or retiree plan, Part B is primary, so you want to make sure you have Part B of Medicare. The second biggest mistake is not properly analyzing prescription drug cards. Okay? This could cost thousands of dollars. In that last example, we quickly ran through, but it would have been an $8,000 mistake if he selected the card that he wanted to take versus the one that covered all of his drugs. The tool to use is Medicare.gov. That's where you can analyze those drugs and determine what the best drug card is going to be. The third biggest mistake is not knowing the difference between Medicare Advantage and Original Medicare. Okay, this is, we went through that slide that showed the chart between all those differences. It's very important you understand when you sign up in the path that's right for you. The fourth biggest mistake is not properly analyzing retiree coverage. So a lot of people have great retiree benefits, and it's good to stay with that retiree plan. But there's a whole other group of people who have a retiree plan, and just because it's a retiree benefit, they think it's the right and the best option for them. And they could be paying, $300-400 a month, and there may be something that's cheaper for them that provides better coverage with, like a Medicare supplement and a drug card. The fifth biggest mistake is listening to your friends and family. And we see this most often with the drug cards, but we also see it with the other coverage as well, where something may work for somebody, but it's, especially with the drugs, you've got to look at your specific list of drugs to pick the right drug card for you. Okay? Doesn't matter if someone else is happy with their drug card. Unless they have the exact same drugs as you and live in the same zip code and go to the same pharmacies, it's irrelevant. Okay? So we wrapped just on time here.